I'm indeed Van De Velde Dominique from Ghent University, and my colleague is here together with me, Ine Huybrechts, who will take the questions later on during the discussion moment. But I'm the presenter and Ine is here to answer the questions, but it is the work of the entire team and all the names are indicated there. So I'm not going to name them. But what we did during the past year was the implementation work of the digital tool ALIVIA. And ALIVIA is actually a digital tool that has been developed by our government in Flanders to promote goal-oriented care. And actually, goal-oriented care is about shifting from what matters to the client to what matters with the client. And to make it a little bit more specific before we go into the digital aspect, goal-oriented care is when a person with a chronic condition comes to the general practitioner or to the nurse or wherever he needs to be, it is better to ask the question, were you able to pick up your grandchildren from school today, rather than how was your blood pressure today? Because this shift in clinical reasoning from the professional puts the discussion directly in the life goals of the individual rather than in the medical aspects of the individual. So there is a totally different way of clinical reasoning. So it requires from the professional a different attitude, different skills, and another way of working together. And a very specific aspect in ALIVIA is that the patient is always in control. So what the government did is, can we make this goal-oriented aspect, can we make that possible through a digital tool called ALIVIA? So this is a little bit the state of the art, or setting the stage a little bit. And what did we do as a research group? There were two pilot projects on the use of ALIVIA within a real-life situation. And we as researchers try to observe and to interview the people who used the digital tool for care planning, setting life goals, defining care goals, coordinating care in an interdisciplinary way, and so forth. So this is what we did. Important at the moment, ALIVIA is not yet implemented in normal daily practice in Flanders, because we are developing another ALIVIA 2.0 based on the experiences from these two pilot projects. So we are in the running to have a full equipped ALIVIA tool that is possible to implement, let's say, next year, depending on how quickly we will proceed. So now to get a little bit more into detail about what we did and relating it to the digital aspect. The first thing that we did was education and training. As I said before, ALIVIA is a digital tool that is used by the patient himself, and the patient gives permission to all the healthcare professional that's surrounding him or her to get access to the digital tool and to share what are the life goals, what are the care goals, how is the goal, how is the care planning going on, and so forth. So there is some kind of a communication between all the partners within the care program of the patient. And in this training, we trained the patients on how to use the digital tool. We trained the professional on how to use the digital tool. We trained them how to switch from one screen to another, to help them to push the buttons. We make them feel safe so that they didn't have the feeling that they could do something wrong, that they were safe within the digital surrounding. So we educated them in the first place. And afterwards, when they started working, we had some interventions with the patients, with the professionals, to guide them through the process of digitalization the process of goal-oriented care. The next step, that was the piloting of ALIVIA. We included some cases based on what the government told us what would be a good pilot and so forth. And we had the people just experimenting with ALIVIA, try it out, experiment with it, try to write down something in it and see what the GP does with this, and see what the PT or the occupational does with the information that you have written down in the digital tool. And then they will free just to experiment with the digital tool. And we experienced this as very important in a safe surrounding, without having the idea that they could do something wrong and could share information with other people that are not allowed to see the information. So it was a very safe environment. During this piloting, we as researchers observed what happened during some kind of a shadowing approach. We were just there as researchers when people filled in or administered the digital tool. And afterwards, we interviewed them to see what went wrong, what went good, what were your experiences, and so forth. So this was mainly what we did. And now the question is, what did we learn? And we have tried to make a scheme of it. Well, actually, Ine, who is present here today, she is the big brain behind the ideas that have been put forward here. There was one aspect that was about the functional aspects. Does the IT function well, or didn't it function well? The technical aspects. Could people log in? What were the problems when logging in? And as I said before, there was an intervention, and there was some kind of help that people could get in touch with the researchers to help them out if there was something wrong on a technical aspect. This was experienced as very important to get as well the patient as the professional going throughout the process, because they knew if something is wrong, I can call someone and someone will help me out. This was considered as very important. Second aspect is the normative aspect. That means that everyone, professional, patient, informal caregiver, has to be aware of, we are talking here on goal-oriented care. Everyone needs to be reasoning, or the clinical reasoning process should be in the goal-oriented care perspective. That was a normative thing. And the third aspect that was very important was, is it possible through the digital system to collaborate with each other? Is the general practitioner able to get connected with the physical therapist? Is the physical therapist is he able to get connected with a social worker, and so forth? So the interdisciplinary aspect was very important. Now, this was one aspect. On the other hand, we saw that there were three aspects of paramount importance. First, the objectives. Second one, the processes. How are the processes, the digital process, how does that run? And what are the challenges that we have learned from our pilot projects? If we go through the objectives, one of the objectives from the functional perspective was, we want to have a digital tool where we have a shared file on all the things that matter to the client regarding goal-oriented care. That was the functional aspect, having a shared file. The normative aspect was, well, if the patient puts into the system, my life goal is to be able to get my children or my grandchildren from school every Wednesday afternoon, well, that's a start for every individual professional to see, what can I do to reach that goal? And then we go to the third part, the integration, the collaboration between the different professionals and the patient was improved a lot. So communication and alignment was very important, and it's made possible through the digital system. If we go a little bit further and go to the process, Then the most difficulties were in when we related to the functional aspect, getting access, navigating through the different pages, trying to experiment with ALIVIA, trying to write down something and see that it's written in the wrong page, that they had to, the possibility to go back. And so these functional aspects were very important, as well as for the professional as for the patient, to ensure that they can make mistakes. There is no problem in writing down something wrong at the wrong place. And with our desktop help, it was very easy to help the people out. The normative aspect, communication about what are the life goals, what are the care goals, and how are we going to plan the care in the future, was facilitated through the digital system. Was very informative. And we saw that people did get connected with each other through the digital system. And that was very interesting for us. So mainly what we learned, that is that participants, patients as well as professionals, recognized the value of the digital tool. They were not afraid of getting into the tool, logging in, sharing information with each other, and it created a way of being able to have a more person-centered care through the digital system. Sharing information, promoting patient participation, and mapping the needs and the wishes of the patients were some areas that popped up to be very interesting by using the digital tool. But of course, we bumped into some problems as well and some challenges. And these challenges I have written down in the next slide. Most of the time there was some, or very often, or sometimes there were technical errors that people didn't get into the system, logging into the system, logging out of the system. So people needed help. So this is something to consider when we go to ALIVIA 2.0. And a very important aspect, if we go to further digitalization of medical and paramedical information, that is, ALIVIA should be integrated in other e-health platforms. And this is something that we need to work really on, because if there are some platforms existing next to each other, it won't work. If the GP has to log in an Interai platform, for instance, and then in an ALIVIA platform without having a connection between the two, that won't work. So we need to work on that as well. So this is a very important aspect that we have learned. There were some problems on formulating life goals. That is more or less a normative and not a functional digital problem, but also there we have learned a lot. There is also a pitfall of people that will use a digital tool as, well, we are obliged to use a digital tool because now there is a new top-down approach and it's called ALIVIA and we have to use it. Well, let's use it, check we have used it. And this is not what we mean by using a digital tool. It is really the goal to have some kind of an interdisciplinary, facilitating digital tool that helps people in collecting data, having information shared throughout everyone, and ALIVIA makes that possible throughout the pilot that we have seen. And we hope to have ALIVIA implemented within a few months, within a year, in a broader context. So this is